You're excited to talk about this, so hit it.
My favorite topic.
Right, one up.
The pain
One
cycle.
up.
So we're going to talk about a little bit of the chronic pain cycle. So and the difference between an acute and chronic injury. So really simple as this.
Yeah.
We're going to use stubbing your toe as an analogy. So if you wake up at 5 in the morning and potentially have to go to the bathroom and you're not paying attention and you clip your big toe like in between that jam, you know, where it goes sideways and the other 4 go this way, it's extremely painful, right? And what you can do right there is realize this is acute. This just happened. That is a noxious stimuli. That is trauma going into the foot that you feel. One way to interrupt that is like back when you were a kid, your mom used to rub you really hard when you'd feel that. That's one way of breaking that slow, constant pain cycle in an acute setting. So acute setting means there's trauma, we actually have an injury there, and there's pain.
Sure.
When it becomes chronic pain, this is 6 months later, we know your toe isn't broken, and if it was, it's not broken anymore.
Sure, it healed.
It healed. But you're still having pain. And you haven't stubbed your toe in 6 months. Why do you still have pain? So at this point, the pain begins to centralize, which means central is referring to basically like my central nervous system, my brain and my spinal cord. My brain and spinal cord makes up the central nervous system. From there, everything goes out to the periphery. So out into the limbs, out into the extremities. When you first smash your big toe, the pain and injury is in the periphery. It is not in the cord, or it's not in the nervous system, the central nervous system. So what can happen over time is a phenomenon occurs where your body still is acting as if there's an acute injury, even though there's one not there, and the pain has centralized. The concept and sensitivity to the pain you begin to feel is up higher. Like it's almost like a memory or a thought of pain that exists.
It's like a learned pain.
It's like a learned pain. This cycle is very common with low back pain and requires diligence to break it, because we have to tell your body that this is no longer injured and to stop acting like it.
It's like a sensitive car alarm.
Yeah, so that's a great analogy. Why don't you talk about that?
So what he was talking about, I'll use an analogy here. So for example, when your body's healed, yet you're still feeling pain, it's kind of like that annoying car alarm that you always seem to walk by in the parking lot, where you brush by it, you barely even touch it, and you take a breath on it, and the car alarm goes off. Right? That is basically what's happening with your body, right? In that scenario, in the chronic pain scenario. And what we want is to break that pain cycle, so eventually that car alarm only goes off when someone's trying to steal your car, as opposed to somebody looking at your car. Right? Big difference there.